Welcome to Learn Public Health. In this video, we'll look at the difference between communicable and non-communicable diseases, and talk a little about their impact on global health. Non-communicable diseases are not infectious, meaning that they cannot be passed from person to person. They typically last a long time and progress slowly. Examples include heart disease, stroke, cancer, diabetes, and chronic lung disease. Each year, non-communicable diseases are collectively responsible for around 3/4 of all deaths globally. They affect people of all ages and in all parts of the world, and are the biggest cause of premature mortality, defined as deaths occurring before the age of 75. Heart disease and stroke are the world's biggest killers. The risk of developing a non-communicable disease is increased by certain behaviors, such as tobacco use, lack of physical activity, unhealthy diet, and alcohol misuse. Globally, tobacco use and unhealthy diet are the leading behavioral risk factors for death. We'll talk more about how these behaviors affect people's health and how public health practitioners work to reduce their impact in other videos. Other indicators of increased risk relate to things happening in the body, including raised blood pressure, or hypertension, overweight or obesity, high blood glucose levels, or hyperglycemia, and high levels of fat in the blood, or hyperlipidemia. These are known as metabolic risk factors. Elevated blood pressure is the leading metabolic risk factor for death globally. A communicable or infectious disease is one that is spread from one person or animal to another. Communicable diseases are caused by microorganisms, including bacteria, viruses, fungi, and parasites. Depending on the particular microorganism, there are a variety of ways in which someone can catch a communicable disease, including contact with blood and bodily fluids, eating contaminated food, breathing in an airborne virus, or being bitten by an insect. Examples of communicable diseases include influenza, measles, COVID-19, Ebola, and HIV. Lower respiratory tract infections, affecting the lungs and lower airways, are the most deadly communicable diseases worldwide. As well as causing death and ill health, communicable diseases can hinder countries' social and economic development, and pose significant threats to international health security. When more cases occur of a communicable disease than would be expected within a specific place or group of people over a given period of time, this is known as an outbreak. We'll look more at outbreaks and the role of public health practitioners in preventing and controlling them in other videos. To sum up, non-communicable diseases cannot be spread from one person or animal to another. Communicable diseases can. Non-communicable diseases are the biggest cause of deaths globally. Tobacco use, poor diet, lack of physical activity, and alcohol misuse substantially increase the risk of developing and dying from a non-communicable disease. Public health practitioners are concerned with reducing the impact of both non-communicable and communicable diseases on the population. If you'd like to find out more, don't forget to subscribe to the Learn Public Health channel. Please give this video a thumbs up if you found it useful, and leave a comment below to tell us about any other public health topics you'd like us to cover in future.